come back to that. Hey, hello, Birdie Gunyon Myers. Thank you so much for joining me today for my podcast called Misconceptions. And Birdie, I know you professionally. We are friends, and I feel like you are one of these like leaders in the industry. And I felt like if I want to talk to somebody about like the basics of perinatal mood disorders, I want to talk to Birdie.
Oh,
And not only because you're like a fabulous presenter and a fabulous teacher and funny, but you've been in the trenches in a way that I think many of the newer therapists don't get exposure to that. And you've been doing this for a long time. And you're very young, but you've been doing this for a long time.
yeah.
Um, I want to explore with you today a bit around what is this term perinatal mood disorders, but more specifically, we're going to move forward into this conversation around like support groups and what you've seen work, how you created one. But what are people saying? Like, what do the women say when they are struggling with parenthood? So, first, before we go, Birdie, tell me a little bit about yourself. Tell me who you are.
Okay, thanks for having me, Devora. So I am a nurse, and I actually started out in cardiovascular critical care, and at some point learned a lot. Oh gosh, that was a good beginning as a nurse. But at some point, I got pulled over to the OB side, which I never wanted to be an OB nurse, and at that point, fell madly in love with the whole OB GYN area, NICU, nursery, all of that, mommies and babies, and became a lactation counselor, a childbirth educator, just did everything. And I did a lot. I worked at a large hospital system in Indiana. I'm actually in Indianapolis. And we had 15 hospitals statewide, Indiana University Health, and the largest ones in Indianapolis, which my main office was at a downtown hospital. I did lots of setting up of programs, both in cardiovascular critical care and in OB. But in OB, I set up a mother baby home visit program, and I set up a retail store when we were selling pumps and nursing bras and that kind of thing. And then one day, somebody came to me and said, Birdie, do we have anything for postpartum depression? And I said, no, but I'm the OB nurse with a master's in psychology and counseling. So let me look into it. So obviously, I didn't have any mood disorders during pregnancy or postpartum. And I have lots of reasons, probably why I didn't. I don't know. I had lots of risk factors, but I looked into it and I got a hold at the time, think this is 1997. I got a hold of before cell phones, before lots of websites or website URLs were, massively long. But I wrote to and called Depression After Delivery, which was an organization at that time that had formed to help those with postpartum depression, as we called it, and we still call it actually in for lay people. And I got a hold of Postpartum Support International, and I talked to the founder, Jane Honigman. I talked to Helen Jones, actually. I remember in Depression After Delivery, both of those, of course, people are still active. But I got information in the mail and I started looking into it. I sent off to Canada. Actually, they had a great book on how to start a support group and how to write a mission statement. So, oh my goodness, I looked into it. My director at the time said, why don't you just start simple, which was a good advice. And I put 4 hours a week to having a support group once a week. So I started the support group not really knowing anything other than what I read that I got in the mail. And I used my own office phone as what we call the helpline. And so I just left it on forward and I had a message. Then what did I do next? I let all the OBs know that I was starting this support group in this helpline. And so I went around to all the OB offices because I wasn't busy yet. Gosh, I didn't have time to do that later on. But in the beginning, I just went office to office and talked to the staff and said, here's what I'm doing. Send your people, send the women to me when you find them, so within really a couple of months, I got my first phone call. And I must tell you, Devorah, I didn't have a clue what I was doing. That first woman that came to group was a nurse, a NICU nurse that I'd never met. She was at one of my hospitals, and we had 5 hospitals in the city with Indiana University Health. And she was at the Children's Hospital and worked in the NICU there. And she was suffering bad, really bad, high anxiety, not what we had been taught postpartum depression looked like, right? Yeah, she had some depression, but hers was mostly anxiety and OCD and intrusive thoughts. And to be honest, oh, she was so ill that I should have hospitalized her. She didn't have psychosis, but she was very ill. But what happened was every week she would show up and we would talk, and I would keep reading. And then I would call someone else who already had a support group and say, what should I, and who was a therapist, what should I do next? What do I do now? It was like using her as a supervisor. And I had a pager. Remember, before cell phones, we wore pagers. And this woman would page me if she needed to talk. And so I would get pages. I would call her back, not on the cell phone, remember. But I don't know how we made it. I don't know how she made it. And I learned so much from her. I still stay in touch with her to this day.
Oh, wow.
Yeah. And so in 2000, I actually went to Walnut Creek, California, and took PSI's 2-day training, which now you and I both teach, and I'm in charge of. And so, as we say, the rest is history, right?
The rest is history. Talk to me a little bit about when you were in kind of getting into this field, what were you noticing about the people who were coming through your doors? What were you hearing from them? Because I think like, some people have depression. That idea of depression is like under the covers. I'm sleeping too much. I can't get out of bed. And yet we don't always see it the same way when we're working with women who are postpartum. What were you hearing? Tell me a little bit about their stories. What were you hearing from them?
Yeah, especially in the beginning, like I said, when I didn't know what I was doing, but over the years, it's been pretty consistent. And that is that I would actually say I felt like the majority of women that were coming to me, and I would do an intake, and then I would invite them to support group. And of course, the biggest part of what to do next is what am I going to do with them next? But support group was the main thing I could do. What was I seeing? I was seeing lots of anxiety, just lots of, I can't do this. This is overwhelming. If I'd known it was going to be this hard, I wouldn't have done this, or I would have waited. Anxiety. I'm not doing this right. I'm not a good mom. This baby deserves more than this. Just that. I can't sleep. I can't fall asleep. I can't stay asleep. What if my baby stops breathing? What if my baby dies of SIDS? What if my spouse leaves me and I'm left alone to take care of this baby by myself? So lots of anxiety and unsure of what they were doing, that sense of, we think we're going to have a baby, and just suddenly have mother's intuition, parents' intuition. And instead, what does this cry mean? How do I soothe my own baby? Breastfeeding not going well. And you just think everything's going to go perfectly well. So all the anxiety around that, not sleeping, not falling asleep, not staying asleep, not being able to go back to sleep, and not being able to eat, no appetite. And these women were losing weight rapidly. Not only not able to eat because they couldn't swallow, the thought of food made them sick. Many of the women vomiting every day, and they'd say they'd vomit in the shower and cry and yell, and it felt awful. but also just a sense of being a new mom and not having a clue. How do I figure out how to eat? When is there time to eat? I'm busy all the time. I can't do all this. And yes, people are bringing me lasagna casseroles, but when am I supposed to warm it up and sit down and eat it? There's no time for that. I don't have time to sit down and eat. So all that uncertainty, that anxiety, I'm not doing it right. I haven't been myself since the baby's been born. And later I worked on a slogan for the state of Indiana when we got a large grant, and we used what I heard over and over, and that was something's not right. I don't know what this is, but something's not right. You told me to watch for crying. I'm not crying, but
I'm
something's
just not
not right.
myself. That's right. I know that
I
there's
haven't
something.
been
I'm not myself.
myself.
Yeah. Yeah. And I think that's so powerful because I think that, we're in the field, but, talking about this stuff is normal for us. But for people who are laypersons who are not familiar with this terminology or the symptoms, what they're feeling very often feels just disorienting. It's like they don't know where these thoughts and feelings are coming from. And I think there's a lot of shame around them acknowledging that they're having these thoughts. I know when
Yes.
I had my first child, it was just an assumption that I would know what I was doing. Why? Well, because I babysat. Well, I hate to say it, but like babysitting doesn't really prepare you for
It
getting up in
does
the middle of the
not.
night and taking care of your baby, right? So,
No.
what really prepared me for parenthood, it was a very strong feeling of sink or swim. And I do remember I was lucky enough to have my mom come and visit and show me how to bathe the baby. But if I didn't have a mother who was able to come, available to come, alive and well enough to come, who would have taught me how to bathe the baby? Today, my kids would probably say I'd go on YouTube and I'd figure out how to bathe the baby. But
True.
we didn't have but even that feels exhausting to me, right? That idea of like finding this information, and how do I know this information is good information? And so if I'm dealing with this anxiety of like trying to get it right, how do I know that this person is correct in how to bathe the baby versus this person who's telling me to do it differently? We're living with a lot of like expectations
True.
of just you're going to figure it out, right? Do you remember what that was like when you had your first of like
Oh,
just
I
figure it out?
You know what? I'm going to tell you something funny. I was already an OB nurse. So before I even got pregnant, I was a lactation counselor and I was an OB nurse working in postpartum and nursery. So I taught new parents. I assessed that new baby when they came into the nursery, because in those days, babies came straight from labor and delivery into the nursery, and the parents didn't get them back for 3 to 4 hours. We kept them in there for three to
Right.
four hours, and we gave them their first bath, and we did the whole head to toe check. So think about this. I have all this knowledge, but it didn't make any difference. See, I taught new mothers. We had a little class where they went home on how to bathe a baby. And I also taught childbirth education. But, oh, and I always, I like to make the joke that we taught you in class how to change a diaper on a plastic doll, which does not prepare you for when that baby poops all the way up to the back of the neck, right? Even I didn't know that teaching it. So my mother-in-law came to stay with me, and she actually was disappointed because she didn't get to teach me some basic things like that. She said, "Oh, I wish I could teach you how to bathe the baby, but you already know that because you taught other mothers how to do that." But it was different. It was my own baby, and you feel so inadequate. In fact, when I was pregnant, I don't even remember what it was that something I think I spotted some blood near the end of my pregnancy, and I had like some cramping, and I actually called my OB. And you know what she said to me? Now, she had worked with me for a couple of years. Birdie, she heard my anxiety, and she said, "Birdie, I'm going to ask you something right now. If one of your patients asks you this same question, what would you tell them?" And I realized that I knew the answer, but because it was my body, this was a lot different. And when my first baby was here, this was my baby and my fears and my worry. And I wasn't an expert with my own baby. I did not know what my baby's cries meant, not a clue. I didn't know how to calm my baby. I didn't know how to, oh, I remember her screaming and thinking I should know what to do. I
Sure.
teach other mothers in the hospital. I teach a childbirth ed class. I didn't even know what to do in labor and delivery, and taught childbirth education classes. I messed up bad during delivery. They told me to stop pushing. I didn't stop. I went ahead and pushed. Got a fourth degree tear out of it. I mean, I look back and think, oh, that was so ignorant. But I did it. See, when it's you, you feel so inadequate, not a clue what to do. So no, I didn't know what to do. I think I felt probably a little more secure than maybe some other mothers because I had work, but it was my baby.
Right.
It was still
Right.
my fear. What if my baby
Right.
stops breathing? And
Right.
yeah, very scary, very inadequate.
I think that like that sense of kind of being kind of assuming that you to assume this role, you will be assuming this new role and
Yes.
you'll just figure it out. And I think when we think about all the things that come into that space of new motherhood of how do I know if I'm being competent? How do I know if I'm doing a good job? And all of those insecurities that we might have experienced in younger years are going to still show right back up again, I think, when we're facing this new experience. So if in younger years or childhood or teenage years you've experienced those kind of feelings of like lack of confidence or insecurity or like self-doubt, they're going to show right back up as you become a new mother. No matter what amount of therapy you did, I still think those insecurities are going to show up, right?
True.
Because you're faced with this entirely new process and experience. And I think one of the things that there's been some wonderful movement in the direction of showing creating language around these insecurities, these fears, as well as the recognition that anxiety and depression, you call them best friends, right? Like they like to hang out together,
They
right?
do.
And talk a little bit to me about what depression might look like. So you talked about what anxiety might look like, and I think all of us can kind of really we can connect to that idea of that fear of the bad things happening. What about the depression? What do we notice in the language that our women are using when talking about their depression? And obviously, in the acknowledging that men also get depression and men also get postpartum depression and postpartum anxiety, right? So it's not exclusively a hormonal issue and it's not just an exact process of giving birth. These emotional um transitions are difficult. And so we'll look at both. But for today, looking at the moms, what do we hear when we hear from a depressed parent?
Yeah, with the depression, it is oversleeping. Don't want to get out of bed. And it's more of just wanting to stay in bed and don't want to face anything. Just I don't want to get up. And that sense of depression is so bad that I just cannot function. Um, a weight. They'll talk about just feeling this weight on them that is overwhelming and oversleeping. And yet, when they get up, still so tired, never rested. And, typically, and this is stereotypical, it could be the opposite, but like I said, with anxiety, not eating, no appetite. With depression, many times it's overeating, but it's overeating junk food and sugar and chocolate. Therefore, just shooting that blood sugar up and down and up and down and up and down, which makes you feel even worse. Just get a high from the sugar and then crash back down. And so they are just grabbing candy bars and chocolate and eating just junk and feeling even more yucky, adding more to that depression. But that sadness, it is a sense of overwhelming sadness, crying. I can't do this. I can't function. I've made a huge mistake. Um, and I both know just having that history of depression or anxiety. But I know I've had moms say, like, the first time maybe they got anxiety, and maybe with the second baby they'll call me and say, this time around I'm having depression. It's not anxiety this time, but depression. And so that's a totally different feeling. Is the second your eyes open up, you say, oh, I
Right,
can't
right.
face this day.
Right. What's important, I think, also to remember it, and for our audience members to know, is this idea of an agitated depression. I remember hearing this term from Hillary Waller, this from the
Yes,
postpartum stress center. This idea of that they may actually still be getting up and attending to the baby, but they will do everything they can to try to put that, as soon as they're done attending, they'll put the baby down and go back to bed. Right. If there's somebody else who could take over, please just feed the baby, take care of the baby. I'm not able to take
right,
care of. And so it might not exclusively look like under the covers feeling, but that's where they're trying to get back to on a regular basis. So not to be like confused by the fact that, well, she's feeding the baby or she's bathing the baby or she's changing the
right,
baby's diaper, but maybe there's like going a little bit of a longer period that then maybe would be best recommended for that baby's diaper to be changed, or maybe not getting the baby when the baby's crying as quickly as perhaps might be
right,
recommended, right? We had
right.
I did a consultation once on a call where a woman told her OBGYN that she was really struggling. This is one of these difficult consequences of sharing information with our medical team that doesn't quite understand what the parent is going through. But what was repeated to me was that she had said to the physician, I just sometimes have to let her cry in her crib because I can't attend to her anymore. And she cries a lot. And so
Hmm.
sometimes I just let her cry. And I suspect there was more to the case than what was revealed to me at the time, but that it she felt that the physician felt that this warranted a phone call to Child Protective Services for neglect.
Oh,
Yeah, and why was this woman there in her office was to get help, like, "Please help me." And
right,
unfortunately, boy, did that, fail her I was so frustrated because I thought like, "Well, where do we want these moms to go when they say, I
right,
cannot attend to the needs of my baby?" I think this is one of the greater, broader issues that we're coping with, kind of societally. But
right. That's
looking at that,
missing that
yeah,
sign of depression, isn't it? It's totally
yeah,
missing that that is part of that depression of I can think about moms in groups saying, oh, when I hear them poop, I just think, I can't change another poopy diaper. I hear
yeah,
them cry. I just can't get up. That's what you're talking about. I just
exactly.
can't get up again to do
Right.
this. I'm so tired.
Right. And that mother was honest and she said to her doctor, like, I need help. Like she was asking for help.
Yes.
And I'm assuming she off got her help as well. And she was hospitalized. But I think what was missed was that is a symptom when that mother
Yes.
feels like I cannot do this for another round of diapers and bottle feedings and crying babies.
Right.
That is a symptom that we need to be looking deeper into the emotional experiences of these women and of these families. What
Right.
were some of the things that you noticed was particularly helpful when you had these support groups and you got that crew together, not one but a few? What what was the magic, if you want to call it that, or what was just the
Yeah.
value of what happened among these women?
Oh, that's a great question, Devore, because it was magic. It really was. Every single group was magic. And it's that sense of, I'm not the only one. That sense of course, we have ground rules. This is confidential. What is said here stays here. When you leave here, you tell your own story and nobody else's story. They had to have a sense that this was a safe, non-judgmental place. But what happened in that room was really a lot of what we have as our motto at Postpartum Support International, and that is, you're not alone. This affects 1 in 5 to 7 women. You're not to blame because we educated on this is caused by risk factors. And sorry, but you happen to have a lot of risk factors. And with the proper help, you will get well. And that was lived out in group. That sense of, I mean, I think about the magic of somebody would come in new and they would see someone else there with a 6-month-old. And I know they would tell me later, like I would think, oh no, am I not going to get better by 6 months? But they would soon find out as the new ones come in and they sit there and they can't even talk. They just sob. And those who have been coming for 6 months they say this exact thing. It's okay. Go ahead and cry. I was the same way as you when I first came. And they would say things like, I was a hot mess. I sat there and cried, but you know what? You're going to get better. So they would give that hope that you're not alone and you are going to get better. This isn't your fault, because that's how they come in. And that magic would happen as we would talk, and people would be able to say things that they couldn't say anywhere else. In the beginning, of course, we didn't have social media, but even now, the things you can't say on social media, you can say in group. You can say, I'm not madly in love with my baby. And no one is gasping, because guess what? There are other people in the room who aren't madly in love with their baby. They can say, I am rageful. I am angry. I am screaming at my toddler. I'm screaming at my spouse. I'm so embarrassed by that. And we can talk about that. And of course, I'm not saying that we want an unsafe environment. Of course, we deal with if the rage and the anger is out of control, but it is very common, and way more common than we realize, these symptoms. To be able to say, I don't feel like doing this. I don't want to do this anymore. And yet knowing that I'm not going to call CPS on them, that this is a safe place. I'm not calling Child Protective Services. I'm not going to take their baby away, that we're going to talk about how we fake it till we make it. You smile at baby, whether you feel like it or not. You talk to baby, whether you feel like it or not. You sing to baby. You do things that, this is new. You don't have a clue. I used to say, you just met her a week ago. You don't know what her cries mean. And that's a sense of, oh, thank you for that. So it gives that hope. Group is about getting together with other postpartum people, whether that's a dad's group or a mom's group. But I ran a mom's group, and I also did family night. But in my mom's group, just that sense of, I am not the only one. And not everybody in the group had anxiety, and not everybody had depression. And some people had both. And some people had traumatic births. And some people had OCD and intrusive thoughts. And that could be talked about, not the actual intrusive thoughts and not details of the traumatic birth, because we don't want to trigger people in group. That's left alone for your therapist in a private session. But that's, I think, is that non-judgmental, safe place where you can actually say what you're feeling, how you're feeling, and to know that it is common, right? I know that you used the word commonize, and you got that from someone. Instead of saying normalize, to commonize it, to make it feel, oh yeah, this is really common. And you look around the room, I think of somebody who said, when I ask, how was your week, when we're going around the circle to talk, and everybody gets a chance to talk, and everybody gets a chance to ask questions. And there's lots of psychoeducation that goes on. That's also the magic of teaching, and that's part of the leader's job. But I think of one woman who, when it was her turn to talk, she just started to cry, and she said, I yelled, shut up at my baby. And the shame she felt, that was her just frustration, because we don't realize that at first, when that baby cries, you're like, oh, poor thing, and you're patting the baby on the back. And then after an hour of screaming, yeah, what do you want? You
Right.
never thought you would say, what do you want, to a
Right.
sweet little fragile baby, or to yell, shut up. And so
Right.
the shame that she felt. And so I asked the group, has anybody else ever yelled shut up at their baby? And 3 other women raised their hands. Oh, yeah. And then she said, oh, thank you for that. Because that sense of, I'm not the only one. Do we need to talk next about how to make sure we walk away and that our
Right.
babies are safe and that we don't let our anger go out of control? Yes. But that's also the magic that happens at group, that they
Right.
know this is a safe place to talk
Right.
about these feelings that you don't talk about anywhere else.
And I think that like that solution component of okay, so I just met 3 other women that did this too. I would think about myself in that group. I'd be the first to say, "Well, what do you do about it?" Right? Like, "Well, how do I
Right,
fix this?" Or "How do I feel better?" Or "How do I respond?" What are
right,
some techniques that you do in order to make that baby stop screaming, right? And I think that there's so much value in the collaborative parenting in that way of I'm not going to have to do this alone. I have my people who can
right.
guide me. And I think that it's something also to consider when, I feel like today a lot of us very often are living in more of an isolative environment where we're a little bit more alone than we are in community. And many of
Right,
us, I think, are living with a tremendous virtual world versus an in person world. And you're missing that in person, private, compassionate support. You may be able to find some of that online, but the real time in person support with compassion can, I would say, in many ways be found almost exclusively together with another human. And I think that that's something that we're noticing, that people are very isolated. And I think with some of that isolation breeds some of that shame. And I want to talk about that shame. I want to talk about
sure.
the shame of, it
Oh,
was interesting. I listened to you tell your own story of your baby, and you said, I didn't listen and I pushed and I ended up with a big tear. And I'm listening to that story and I'm going, wait a minute, we're in the throes of labor and you have this urge. And yet there's this internalization so many years later of, I made a mistake versus like my body just pushed. I wasn't listening to anybody because I couldn't hear anybody. And I just had a baby and I was pushing and that thing was coming out, whether I looked right or left, it was happening. Right. And yet we, even so many years later, hold on to that. I made a mistake. I goofed. I didn't listen. That was stupid. Right. I was foolish.
right.
And right.
I
So
knew
many years
better.
later. Right. I knew better. Right. And
I
then
knew better. I knew we had to stop and suction the baby. And that's what she said to me. But you know what my thought was? My thought was, I saw the head because I was watching with a mirror. Not everybody does. I did.
Ooh.
I saw the head come out, and the doctor said, hold on, I need to suction. I know that's what you do. I teach people that's what we do. You're going to pause. You're going to suction the baby's mouth out before they come out and take their first breath. No,
Right.
I saw her head and I said, I got to get her out of there. That's what my
That's right.
mind said. I went ahead
That's
and
right.
pushed.
Right.
Get her
And
out.
then so many years later,
I
we
still
hold
say, I
on to
did it
the I
wrong.
should have. Right. You still say I
I
did it
did it
wrong.
wrong.
So let's talk about that feeling. For you, you might not use the word shame, but just like I get it, I did it wrong. I made a mistake. I could have done it better. I think it's kind of
Yes,
almost like a casualty of parenting. Frankly,
it
we're
is.
always going to show regrets, right? We're going to always feel like I wish I had known what I know now that I knew then and I didn't know. Oh, okay.
Right.
I'm pretty forgiving on those kind of things on myself, maybe a little bit too much, but I definitely feel like, we are a work in progress and our parenting is a work in progress. But it seems that when it comes to motherhood and parenting, we can be so hard on ourselves in where we think that we got it wrong or did it wrong. And I think like I hear the stories of women who are struggling so deeply with I messed up. And that in their mind, messed up means I had depression and anxiety. I was so dysregulated in my moods that I wasn't the mother I wanted to be.
Right.
And then they hold that for years and years and years. And yet, if they were sitting with a friend, their friend would say to them, let yourself be and forgive yourself. Like this was not in your control. And I just talk to me about that shame thread. Where else do you see that show up with the women you interact with on a more regular basis? What are you hearing?
Right. And you made a good point there. What would you say to your best friend if she said that to you? But the things we say to ourselves, that shame that shows up, that shame of, I didn't have the delivery I wanted to have. I ended up with a C-section because I couldn't push hard enough, or even get, you don't even have control. The baby's heart rate drops and you end up with a C-section. My body failed me. I did it wrong. I ended up with cracked bleeding nipples because baby had a tongue tie. I didn't breastfeed the right way. I didn't catch on to that. I didn't end up getting enough milk supply. And I always wanted to be everything about that. I didn't do it right. Everything I did was wrong. That image of the perfect delivery, as if you could do it wrong. You got your baby, and you like. I didn't do it right. I was not going to use an epidural, and then I ended up using an epidural, and I did it wrong. And I failed myself, and then I didn't breastfeed, or it didn't go the way I thought it would, or um, yeah, I didn't fall madly in love with baby, and the shame that goes with that. But all of the shame and guilt of I didn't do it right. And what is that? I guess it goes along with what is that picture of what does that mean that I didn't do it right? What does I wasn't a good enough mother. I'm not a good mom. And what pictures we painted in our heads for what a good mom and what a good parent was going to look like. You're bathing the baby, you're changing the baby's diapers, you're feeding the baby, you're kissing on baby, and yet you still feel like a failure because you're
Yeah,
not doing it the right way or the way you imagine doing it. So
hmm,
that shame comes out in almost everything, doesn't it? Baby's not
absolutely.
sleeping for 4 to 5 hours. Somehow that's my fault.
Right.
I
Right.
immediately start the blame on everything.
Exactly. I think that that also shows up in some of the messaging that we're getting from social media of like this is, what do we tend to see? We want to see pretty happy people, right? And so pretty happy people who put out there and their kids look so clean and they're matching and their clothing is all put together and their hair is all made up and by the way she's wearing lipstick and you're looking at this image kind of going, am I getting this wrong because of why
Yeah.
is my life not looking like that? And
I'm
there
still
are
in my
some
pajamas at noon.
exactly, exactly. Like, can I just go get dressed, right? And I think that we can especially younger generations today who are very influenced by the social media exposure are really taking to heart even if they claim not to. They're still being bombarded with this imagery of what motherhood is supposed to look like. Those assumptions that it's going to look a certain way and that everybody else or at least most people are getting it right and I didn't. And again, thinking
Right.
about to me, those are like kind of also will feed those risk factors, right? So they may have a risk factor of a difficult childhood, a difficult family history, and then they see what they think everybody else's lives are looking like, and theirs doesn't
Right.
look that way, and then it just kind of becomes this negative cycle of I must hold responsibility in the fact that my kids don't look that clean and are not that matching, right? And
Right.
then what we're left with instead of is a competent, confident parent, we're left with people who really are deeply struggling with this identity of motherhood. And it's tough. It's really, really tough.
It's really tough. I remember one woman that came in to see me for an intake, and I did my intake. I got all done educating her, and she said, "You know what? One thing that I learned the most today is that not everybody is dressed by noon." We have this picture of that you were just going to be as together as you were before you had a baby. You're going to get up and take a shower and put on your makeup and do your hair, and the house is going to be together, and you're still going to cook dinner. And when that doesn't happen, you feel like you have somehow failed. And like you said, the children matching and their hair is done. And I remember heading out with kids with my girl's hair looked awful. I didn't even take the time to pull it in a ponytail sometimes, just or comb
Right.
it. And then you'd
Right.
realize out in public that they look like ragamuffins. And you go,
Exactly.
what? I didn't even do their hair. And
Right.
goodness, I didn't have on makeup and my hair done. No.
Right.
And
Right.
that's the picture that we have. And like you said, what we see in the media are perfectly posed pictures and images. And we can't live
Absolutely.
up to those.
No, it's really impossible. It really is impossible. I think that the more honest we can be about what it was like for what it really is like for a new mom and a new parent to become a parent and what that transition into reality is like, the better our community and society will be because I think they'll be able to see that it's not a reality out there. It's just not a truth. And being honest about like what I'm capable of doing today versus some other, I think that those are valuable conversations we can be having. I'm wondering as we wrap up today's conversation, if you can come up with 3 misconceptions that you would like to talk about, just mention 3 misconceptions about either new parenthood or depression and anxiety that you'd like those listeners, our listeners, to know.
Oh, you're gonna stump me now. You know, I always say you can't stump me. You might stump me with this. Misconceptions. Well, we just talked about one of them. The myths and misconceptions of motherhood, parenthood is that you're going to have it together all the time, that you're going to be just as competent and together as you were before you had a baby, and parenthood's going to look perfect, and children are going to look perfect in their nice little outfits, and you are. Um, that you're going to know what you're doing all the time. You're not. You're not going to have a clue. You are just clueless when you first have a baby. I had something else too, Dvorak, cross my mind. Um, and I can't think of it right now, but I just want you to know that you're good enough, a good enough mother. And so that myth of the perfect motherhood, that you're going to know what to do. I think that's probably my main answers. I had something else really good, but it's
That's
not
okay.
crossing my mind right now.
I will say that I remember, when I see a mom in the grocery store and their kid is either like in pajamas or in their superhero costume, I
Yes.
always comment. I always go up to mom and say, "You are such a good mom. I love that you let them come to the grocery store dressed like that because you're a cool mom." And I think that, like, I think
Yeah.
some mothers will fight. I have one woman who always is saying to me, like, "He will not get dressed in the morning. He will not put on his pajama. He will not get out of his pajamas." I'm like, "Send him to school in his pajamas. He's 4. Like, he's not
Right.
15." I mean, most 15 year
Right.
olds look like they're going to school in their pajamas nowadays anyway.
Right.
I mean, they walk
Right.
up and down my block. I'm like, "You left the house that way?" Right.
Right.
But okay. But if you let them explore and give yourself permission to smile, then I think that, you might be just a gentler, kinder voice in your head around what it means to be a mom.
Right. And can we just say, that reminds me to say this also, and that is when we see new moms out in the stores and their kids are throwing a temper tantrum, and your heart just breaks for them because you remember that. Don't walk up to them and say, "This is the best time in your life."
It's not. It's
It's
not the
it's
best
not.
time.
It's not always the best time. It's
Right.
not fun all the time. And when we say those things, and it's true, it does go fast. But when you're saying that to someone with a 2 and 3-year-old acting up out in public and say,
Mm-mm.
"Enjoy every moment of this, it goes so fast." Yeah, that's really true. It does go fast. But right now, they're not feeling this is the best time in my life. That could you
No.
please, everyone, remember how hard it is when you
Right.
have toddlers, and let's not forget how hard it is to have teenagers,
Yeah.
and that
Yeah, for
it gets
sure.
different, but it doesn't get easier. It just is
No.
different at each stage.
Absolutely. I like to saying to those moms, "You are so brave for coming to the grocery store with 2 kids," or
Yes,
like, "I remember those days. You're doing a great job, mom. You're staying so calm. You're so," it's just say something nice to the mom,
right.
who is dealing with the tantruming toddler and like, "Oh, I remember those are hard times," like
These
anything
are hard
encouraging.
times.
Yeah. Yeah.
Mhm.
And I think that, when it comes down to one other misconception, I think we have to name in terms of perinatal moods and mood disorders is that it is not uncommon. This is something that is impacting a lot of people. Like you mentioned, the 1 in 5 to 7 women will experience a mood disorder. 1 in 10 dads will experience a mood disorder relating to postpartum and pregnancy. And that means that it is way more common than it is that then we've given it credit. We've given credit to this for so many years. And I think that the more we can remind people that this is something that needs to be addressed and needs to be supported, and we need to rally around them, the healthier they will be and the healthier that the babies and families will be as well. So,
Right.
right. Birdie, thank you for spending some time together with me today and talking about such important topics. And I know that we will continue to have these conversations, and I appreciate you. Thank you.
Oh, thanks for having me. It was fun.